Welcome, everyone. We're really pleased to be able to provide the opportunity for our Secretaries of Health and Human Services for the state of Pennsylvania to be able to be with us today. And I'll turn it over to you all to kick us off.
Right. Okay, great. Well, thanks, Jenny. Well, good afternoon, everybody. It is afternoon now. I am Val Arkoosh, and I have the honor of serving as the Secretary for the Department of Human Services, which oversees the Medicaid program here in Pennsylvania, as well as mental health services, Office of Developmental Disabilities, and many other very critical agencies, including our child welfare, as well as our child care and early intervention systems. So lots of things that you all interact with every single day. And we're really excited to visit Family First Health during National Health Center Week. I am a physician, I'm a mom, we both are, and just the thought of having a health center at my children's school would just be incredible. Like I just, really, it really goes to meeting people where they are and making it as easy as possible for folks to access healthcare. I just want to acknowledge two colleagues. One is Commissioner Hoke, so glad to see you again. Many of you may know I was a county commissioner for 8 years before I joined the Shapiro administration, so always so happy to see fellow or former fellow commissioners at these events. And of course, want to welcome and acknowledge Representative Carol Hill Evans. You're so lucky to have this in your district. So, yeah, so glad that you could join us today as well. Again, just want to thank you all so much for the work that you do every single day. It's critically important to make sure that everyone in our community has the opportunity to get much needed healthcare services and education so that they can keep themselves and their families healthy. And I know we've got a family mom here who we'll hear from shortly. And I also just want to take this moment to highlight the fact that these centers often come together with lots of different partners. And while Family First is able to bill Medicaid when someone's covered by Medicaid, we know that all the people that you see aren't necessarily, and that we're so grateful for sliding scale opportunities and other opportunities to make sure that this healthcare is accessible to everyone. And of course, United Health Foundation has been just a huge partner in this work and given really pivotal grants, I think, to Family First to make sure that this work can continue to grow. So we're really grateful for everybody who comes together. These are really community centers, and I think you're experiencing that or demonstrating that to its highest degree. I am a huge fan of school-based centers, and I hope to learn from this visit and figure out, what can we do at the state level in the Shapiro administration to both strengthen existing school-based centers and grow them. I feel like we could just benefit tremendously by having school-based centers in so many more of our schools. And I also just want to bring up one topic very quickly that's quite top of mind for myself and the governor and our staffs right now, which is that we are now in a period of everyone who receives their health insurance through our state Medicaid program needing to re-enroll in that insurance. During the pandemic, people were able to go for 3 years without having to redetermine their eligibility, is the technical term for it. If people didn't send back their paperwork, it didn't matter. We kept them covered. But now that the pandemic has come to an end, federal government rules require that as of this past April, we do have to redetermine everyone's eligibility in Medicaid. So I'm sure that you're hearing some of that from some of your patients. We know that some of your community health workers are actually assisting some of your clients and patients with that work. And we're so grateful for that partnership, because this is not something that DHS can do by ourselves. This is an all hands on deck moment across every community in our Commonwealth, and we need every partner and every trusted messenger that we have to make sure that the people that we serve are aware that it's critically important that they fill out that paperwork from the Department of Human Services and they get it back to us, because we want everybody to stay covered. So I just want to thank you in advance for any and all help that you're providing with that. So I'm so happy to be here today with my colleague, Dr. Debra Bogen, who is a pediatrician. So she's really even more relevant to this whole conversation than me, our acting secretary for our Department of Health, and just so pleased to be here with you today.
Yes, thanks. And, so thank you for having me. Really, it's amazing to see the facility here. You guys really, really are a model of what we would like to have for all of our children and our families, right? It really is an amazing place. So thank you for the wonderful tour. I could spend all day here with you all if I could. And I think during this, this is National Health Center Week, and I think it's really important that everybody in Pennsylvania know that these exist. And federally qualified health centers and community health centers like Family First really are a gem. And what I found in practice, when I was in practice for thank you. I was a pediatrician for 30 years, and many of the families I cared for did not know what a health center was. And what I would see is I had children who were covered under Medicaid that I'd be caring for, but their parents didn't have health insurance. And I would say, well, you can go to one of the sliding scale clinics in the community and get health care. And people were amazed. So we really need to do a better job at spreading the word about health centers. And that's what this month is about. And that's one of the reasons we're here in August. Of course, I'd rather be here when it's filled with children, but anyway, so again, the care you provide is really essential. And so thank you for doing that. I know it's not always easy. You see people with many, many needs. And what's amazing is you meet all their needs here, right where people are, right? One of the biggest barriers for people getting healthcare is getting to healthcare. And you come where people are every day. And so families, children come on buses, and parents drop them off, and grandparents drop them off. So you are here providing those full services. It's really amazing. And like Dr. Arkoosh said, if we could replicate this to more schools, it would be truly an amazing outcome. One of the other things I think people don't realize is, as a pediatrician, I would often see families, see a child, say, that had an elevated blood pressure, or I put on a new medication, and I don't want to make that family have to take their child out of school, come back to see me for the follow-up that's needed to make sure that child's getting care. And working with school nurses, school-based health centers, you can, as a provider in the community, you can just call up and say, hey, would you mind checking on this child's blood pressure and following up? And that's the kind of win-win for families, for the quality of healthcare services we can provide, for everything. So again, the more we can really support health where people are and meet people where they are, it's amazing. I also heard you guys have community health workers, which again, community health workers are really a vital, I think, underutilized resource in our communities, and very committed to really making sure that model is also advanced. So great to have community health workers here who can link people to services. So anyway, thank you for having me. Thank you for the amazing care you provide. And let's all celebrate Community Health Center month of August.
Thank you, Secretary. Thank you both for joining us today. I've had the privilege of working with Family First Health for many years over multiple roles at United Healthcare. My name is Blair Borak. I'm the CEO for United Healthcare Community Plan, serving Medicaid and CHIP and dual eligible Medicare members in Pennsylvania, but also representing United Health Foundation today. For us in the partnership with Family First, a lot of it is just about the people. Everybody that I've worked with and have come across, from the leaders to the staff to the physicians, just care so deeply and are so mission focused on serving the community. This week during National Health Center Week, we're celebrating community health centers across the Commonwealth, but we're particularly fond of the school-based model. As Secretary Bogen referenced, with the school-based model, it provides an opportunity to remove a lot of barriers to care that sometimes we take for granted. But a lot of families, they struggle with transportation, with childcare for their other children to be able to get to an appointment, or just working multiple jobs to make ends meet. So the school-based model not only removes a lot of those barriers, but sees children in an environment that is familiar and safe to them and is welcoming. So we're really proud of the work that Family First Health has done with the Hannah Penn School. Through the $2 million foundation grant that United Health Foundation has done over multiple years, we've helped the school and the Family First Health Center expand primary care access, behavioral health access, dental access, but also create wellness programs to educate children and really create early habits of healthy behaviors. And that's very, very important. And additionally, the community health workers. I think long before in our industry it was very popular to talk about health equity and social determinants of health, community health centers like Family First this is what they've always been doing, and they get it, and they know how to take care of families in the community, going deeper than just the physician care, but addressing all of those social needs. So very proud of the partnership. I'm really happy to be here today.
Well, we're really pleased to have been able to host everyone today. I want to take a minute to offer some gratitudes. We wouldn't be in this school able to do the things that we're able to do without our partnership with the school district of the city of York. And I'll let them talk a little bit more about that in a minute, but it's critical that we really work arm in arm as we think about the health and well-being of students and everyone that comes into this building. Our goal has really been to ensure that this is the healthiest space possible for the community that kind of calls this school their neighborhood home. And there's a great amount of trust. Actually, that trust even grew and was built to be stronger during the pandemic. And we want to be part of that, and they have welcomed us and continue to support us in the work that we do. And that really enables us to do the work that we do and have the impact that we have. We provide a medical home to about 20% of the students who are in this building every day, and then well beyond. We have about 1,000 active patients in this practice site and provide over 3,000 visits annually. And so this is a busy hub for care. And we have a great team led by a physician's assistant whose home base has been here for 8 years. And then a whole great team around her of community health workers, behavioral health folks, and I'll highlight something that we were able to add with the United Healthcare grant was to experiment with a health and wellness coach. And that individual has brought an incredible new skill set to the work that we do and really helped us build out the team in an effective way. So we are here today to really celebrate and highlight the work that the whole team does. I couldn't do the work that I do without the team. I'd be really falling short on a regular basis. So count on all of them, but most importantly, to put our patients in the center and really know and understand their needs as they evolve. And being in a school-based site really helps us kind of be on the leading edge of that understanding of what the community needs, where the gaps are, and what we can do in partnership to fill those gaps as we move ahead for everyone trying to achieve their best health as they travel through life.
Well, thank you all so much. And I want to thank the principal, too, for having us today. We really appreciate it. And there's this really incredible vending machine in one of the hallways. I'm not going to tell you what's in it. I'm just going to say, if you don't know about it, you should check it out. Very, very cool. So I understand we have a family member here.
So this is Debra Bogen. She has been with us since February of 2021. She first came to us, she moved here from New York. And when she moved here with a friend of hers that was supposed to show her the roots and show her around, but then the friend left her here by herself. So she came to us via our monthly hygiene distribution, where we give out hygiene products to our community within Hannah Penn. And she came to us, and during that time, she expressed how she was scared new to the community and needed help with having a medical home, medical insurance, SNAP, rental assistance, and mostly her utilities. And I just so happened to be the person at the door to greet her. So I'm really going to introduce you. She is a Spanish speaker, and we do have a translator for her. So this is Arkoosh. You can ask her.
Maybe it would be helpful to understand how, as you entered through that hygiene distribution, what came from that? Celia talked a little bit about that, but what doors did that open?
Sí, buenas tardes. Yo me he beneficiado mucho de los productos que dan, porque cuando yo vine para la ciudad de York, estaba sin trabajo, estaba desorientada y sin ayuda de nada, pues los productos de higienes personales me sirvieron mucho, referente, como, ¿puedo decirlo? Los productos. Ok.
So she said when she moved here the first time and she found this program and she received that hygiene products help her a lot because she had nothing at that moment.
Los productos han sido muy buenos para mi familia porque al principio no teníamos cómo obtenerlo y gracias a la comunidad he podido resolver esa situación en cuanto a cosas personales para mi casa y para mi familia.
So she said that the hygiene product helped her a lot because she don't have the resources to get it and help a lot her family and her.
I'm gonna ask her what that means. So, as far as after after you contacted me for the hygiene distribution, what other services did you need help with, and how did we provide that help to you? Okay. Cuando yo vine de Nueva York para acá, como le digo, no tenía trabajo y estaba desorientada y gracias a Celia y a Lisonel Rivera me asistieron con los cupones, Medicaid, servicios para la renta y todos los servicios que yo necesitaba porque no tenía ayuda y gracias a ellas me ayudaron y me orientaron para recibir la ayuda.
So she moved back from New York. Celia, besides, you know, the hygiene products and everything, Lucianes and Celia were assisting her to apply for SNAP and other type of services that help her a lot.
Nosotros te conectaron con lo que tienes aquí. Sí. Me conectaron con los doctores, ya que no tenía Medicaid y no tenía cómo atender a mis niños. Y me atendieron aún así, sin tener el Medicaid, le dieron servicios a mis niños. Y gracias a Dios ya tengo, y a ella que me ayudaron y a la comunidad, ya tengo el Medicaid para mis hijos y lo están atendiendo.
So also, Celia connect her with the Medicaid and also with the side to receive care. So for her and her kids. So now her and her kids has Medicaid. It's helping her to get the service that she needs.
¿Puedo decir algo más?
She wants to let you know.
Yo tengo un niño con una condición especial, él es autista. ¿Qué pasa? Que en Nueva York él no recibía, yo entendía que él no recibía la ayuda necesaria en New York. Y aquí me están dando toda la ayuda a mi niño, aparte de que él tenía otras condiciones que en Nueva York no me dieron. Y aquí los doctores me dijeron que él tenía otras condiciones, aparte del autismo. Y gracias a que lo están ayudando. Y ya ya mi vida está un poco mejor porque yo no sabía que el niño tenía otras condiciones. Y ya lo están tratando y mi niño está mucho mejor.
So when she was living in New York, her kid, one of her kids is autistic, and he was not receiving the right care over there. So when she moved over here, they helped her to identify another condition that the kid has, and we are helping her with that condition and helping her with the care that the kid needs.
Thank you.
Thank you for sharing your story with us. I think that we talk a lot about the social determinants of health. And that's a really fancy way of saying that people need to have safe and clean housing, secure housing, that they need to be able to get healthy food to put on their table for themselves and their family. And they need transportation. They need jobs that pay a living wage. They need to have the education that prepares them for those jobs. And all of those things are the things that make us healthy. And of course, access to healthcare is too. But just having access to healthcare makes it very hard if you don't have all those other things. And so it's just so wonderful to hear how holistic the work is that you all do here, that you're looking at the whole picture and you're really working to promote health. It's beyond health care, which is obviously important, but it's really putting all the pieces together so that a person, a family, a community can be healthy. And just kudos to all of you. That is really the joy and the real opportunity, I think, of our health centers, that you have the ability to put all those pieces together and really serve our community and help lift up everybody in the community. So thank you for sharing, and thank you for helping in such comprehensive ways.
Wonder if it would be a great opportunity for Dr. Berry, who was able to join us, or Dr. Fitch, to comment from a school district perspective.
Well, I can definitely tell you it's been amazing. Over 26 years, going on 27, to be the only school-based health center. Like you said, I wish this would have taken place a lot sooner than possibly in other places. But I know in the school district of the city of New York, this is outstanding. We're able to really address the needs that families and students are having, as well as, like Principal Huffman was stating, get them back into the learning environment. But more importantly, it's a level of care, just like you mentioned. It's a level of support that we want to continue to offer our students, and I'm not going to steal the thunder. I'm going to say stay tuned, because family first and the school district has something else up our sleeve. But I can tell you right now, we are looking to clone Brooke. And we have, because we have nothing but support. All of our employees, especially the team here on the school district side, we have a model. We go above and beyond. And that's just our common call that we need to do, because we don't care if the students in front of you hurting or families hurting. It's our role and our duty that we need to continue to help and support. So thank you again to everyone who's been part of it. Again, Commissioner Hope and Representative Carol Evans, for all the work that you've been doing in the trenches, everything that we've been doing, and we continue to work with Family First Health, but we would love to find more grants to open more of these.
Sounds like we should pencil in a return visit at some point in the future. Yet to be identified.
That's right. We really, as we continue to kind of develop a deeper understanding of the impact of the past few years on young people, particularly in our community, it's providing new opportunities for us to partner and go deeper in that partnership to bring more comprehensive solutions to the impact of the past few years. I think everybody could talk about their own from an adult perspective, and we know that children traveled a really impactful journey. And this is a time, through partnership with school, that we can bring some additional supports to bear. And the community health center model is, we believe, I'm a little biased, but we believe is the ideal model to come alongside families who are really trying to get their feet back under them, and students that are really trying to re-engage and envision kind of what comes next for them after the uncertainty of traveling through a pandemic.
And I would be remiss if we didn't give the floor to our superintendent, Dr. Angela Berry, who has really been a major leader and a force to be reckoned with in this side of town. So, Dr. Berry, is there anything you would like to add?
Good afternoon, everyone. I just am very grateful for the partnership. You know, in education, we always talk about this triangulation between three different things to be able to have a comprehensive program. And this is the perfect recipe for that, in having the community, Family First Health, and the school district together. This partnership continues to grow. It continues to be stronger. We continue to be proud And we continue to brag about all the wonderful things that are going on. We're happy to be able to help community, family first help, as well as them help us. And we see the fruits of your labor every day when our students are happy, healthy, and being provided for in ways that they wouldn't normally be able to do it. So we just thank you for continuing to have a partnership with us, and we thank the community for investing in us and believing in us and trusting us with their most precious cargo, their children.
I wonder if we could ask Nicole and Charlotte just to provide some examples of that thinking beyond the health center itself and our patients that enter the health center, and really those efforts that extend more broadly into the school family.
Sure. I think it's really important to highlight the value that the school-based health center brings to the entire school community. So even just last night, we hosted a kindergarten ready program. We had, about 10 families come out, and we were able to speak with them on behalf of the school. Mr. Huffnagel was there to talk about some policies that are important as far as attendance and dress code. But we were able to connect with them and do some activities with the students to help them feel more comfortable to start that first day of school. And that's really helping to build that relationship right off the bat so that they're aware of the services that are available to them. Maybe they're not in need of them right now, but they're able to have that in the back of their minds moving forward. And so whether it's a student program that we're helping to support, we also have staff efforts that we support so that our teachers and the faculty here are healthy and able to take care of the students that are in front of them every day. And then, as mentioned, community efforts. So the hygiene distribution that we're able to support monthly is a great way to just have that face time with the community and meet their needs beyond whatever those hygiene products are that they need. This year, we were able to branch out into the school a little bit more for health education. We did partner with another local nonprofit for some of that, but then we were able to leverage the health and wellness coach role that I'll let Charlotte speak to do some education right in the classroom.
Yeah, so speaking to what Nicole sort of mentioned, we're able to do some education in the classrooms. Thankful for Nurse Ann kind of going through that process and helping us set it up. That we did CPR education for the 7th and 8th graders, and also did some curriculum on sugar shockers is sort of what I call it, but really identifying the sugars and teaspoons and amount found in the foods that kids are really eating every day and not really realizing it.
So Charlotte's both able to work at the population level within the school and in the individual level through coaching sessions, and really is integrated in the team. So Brooke's able to make a referral, other team members might be able to make a referral. So for that one-on-one kind of support, and then also think about the population level. We see all of this framed, all of our work, but particularly work in schools framed through an equity lens. As our underlying or underpinning of everything that we do is to address health disparities and increase equity and outcomes across our community. And I'll ask Anika, who has been a champion for this work and is really does invaluable work to help us think beyond what we're doing now and always to what's next, and speak into the equity side of this work.
Yes, it's been mentioned, the social determinants of health. And so, mentioning that having access is great, but all those other things that families are navigating is so important for us to figure out what might we be able to do. And so my colleagues around the table know that one of my questions is always, well, what can we do? We can't do this, this, and that, but what can we do? And those seemingly small things mean a lot to our families. The hygiene distribution being one of those things to really be consistent and having that the third Wednesday of every month, making sure that we're showing up even when the weather might not be the best, because our community is counting on us. And so it is important to maintain that consistency to build relationships and trust, because that is really at the core of what we're able to do. Getting our families to trust that we are going to be here and that we are going to advocate for them. And many of the families that we are supporting, they are not coming from a place where they can get in the car and go here, there, and everywhere
And as you mentioned about coming back to the pediatrician, I'm not in that position. And so anything we can do to break down those barriers. We have a phenomenal team. I know Jenny has said it, but I have to say it. We have a phenomenal team that is all in on the what can we do. You know, this might not be something that's prescribed right here that we've done before, but this is something new. Okay.
Yeah.
What can we do?
I'm really glad you shared that, Anika. I mean, when I think about health equity too, kind of traditional approaches of just doing more and more focus of this, your standard programs to address different communities is not very effective. It really requires our partnership with people face to face with members to understand it. And the key word is trust, like you said. It's really there's a lot of times when we're trying to address health equity issues, what it comes down to, we find is a lack of trust and trying to figure out how to earn that. So appreciate the work that you're doing.
And I would add, you know, the population in this building is very diverse. As we talk about race, ethnicity, language. And so I'm going to say we're blessed to have a team that can speak Spanish, that can speak Haitian Creole, which is a growing population in our community. And even just that, someone coming in and recognizing someone speaks my language, to be able to say, oh, okay, now I can have that conversation. So our community health worker team is phenomenal in that realm, and we have other team members as well. But to be able to sit down face to face and say, I understand the words you're saying, and I may understand some of the cultural things that you're bringing.
I might have one question. I'm
Yeah.
not a health expert. My background's in public finance, but I am a city resident. My father taught at Group City Schools for 35 years. I'm a big supporter of the school district. My question is that Jenny and her team does a great job. And they've been in Europe for many years and been an asset to the community. How do we, you as a state, take this model and expand it, but also duplicate it in other school districts and other areas? I mean, we have 16 public school districts in New York County. And like I said, I'm a resident of New York City, and I heard some encouraging words that you're talking about this, which is great. But how do other school districts that may have a very much a need for this in their Hanover school district or somebody like that, how do we expand this model moving forward as elected officials or community members here in New York County?
Well, I'll start and then turn over to Dr. Bogen. You know, I think it starts with events like this. I think that raising awareness that such a thing is possible, and not just possible, but so wildly successful, is where this starts. And that it takes the whole community to come together to make it successful. So, you know, we're seeing slowly but surely more and more school-based health centers being created. And I really like to come visit because I like to understand, like, you know, what were the partners that came together. Sometimes it's a foundation, sometimes it's private philanthropy, sometimes it's, you know, other pieces. And how can we help put something, you know, like a toolkit together for other schools that are interested, knowing that we can't do them everywhere. There's no way enough resources, putting on that equity lens to make sure that we are putting them in the places where it will be the most impactful, where that need is the highest. So I'm just happy to be here to continue to learn and hopefully lift this up and help more communities understand that this is really possible. And it's not that hard to do. It's hard, but it's not impossible.
Yeah. Again, what's really remarkable about this is really that all the community members that have come together and continue to work together on this. One of the things the Department of Health has a lot of, and actually the state has a lot of, is data, right? We know sort of where we don't have enough primary care providers. And so, again, to Dr. Arkoosh's point, really finding the places where this is needed and finding the champions, right? Nothing gets built without a champion or champions who work together. So I think making people aware that this is here and doing a train the trainer model and letting people come and tour your facility and learn from your experience. I'm sure there was never a smooth path, that there were bumps along the road that you've learned that you would want to share with other people so they don't hit those same bumps in the road, I think is really important. But again, using the data we have to find out where is it most needed in our Commonwealth. I mean, we have very uneven distribution of healthcare services across the Commonwealth. We have communities where there are no delivery hospitals for miles around. There are places where there are no primary care providers. And those are the places where, our federally qualified health centers tend to be and work. So again, are these partnerships we can build through, that work and with other FQHC organizations. As you know, I'm a big fan of federally qualified health centers. We both meet regularly with the state organization that supports you all. So again, use the data, find out where the holes are, and see how we can build more partnerships to bring people together and understand that something like this is possible, and the incredible benefit to the community that you all bring, is really amazing. So.
Yeah, I would think that schools and FQHCs and their communities may not be aware that it's possible. They might think, oh, there's not enough room in this school, or to launch that. Certainly you look at the foundation grant. It wouldn't have gone very far if there wasn't already a foundation to build on here, and so it looks daunting and overwhelming. But actually, I think, Jenny, and this example, if we can educate others thinking about this opportunity on actually what it takes and make it realistic and figure out, the details, that they're not overwhelming, I think it'll start generating the ideas, and it might start generating funding sources. I think that's a wonderful question.
I would just add that I think an important point is that the origins of this site were all about access. And so it is important to understand where access gaps and barriers exist in communities, and consider a school-based model as a component of addressing those access shortages. It's not a model that's perfectly aligned for every gap in access, but can fill an important gap. But this is all about a unique access point. And that was based on an understanding, a deep understanding of the needs of the community, and having community members at the table at its inception and continuing to be at the table, and understanding in real time what the evolving needs of the community that live every day around this school and come into this school every day. If their voice wasn't active in our work, we wouldn't still be here 53 years later, and we certainly wouldn't be making the impact on health that we make. We really have to walk this journey in partnership with the communities that we're designed to serve, and then be able to adapt and grow and change and evolve in ways that are driven by their perspective.
Representative, anything you want to add?
I'm the biggest advocate of yours. Everybody in Harrisburg after peppermint patties and barbells. It's one of the things I do talk about, because I'm exceedingly proud of all the little gems that we have. And so when people do say, well, what's the big deal about York? These are the kind of things that I can bring out and say, you have to come see it to believe it, but it does exist, and it is successful, and here we are. So thank you both for being here, all for being here. I do appreciate it.
Great. Any last questions? Or?
Any questions that you all have? We have a great group around the table. I tried to highlight some of the gems, but are there any other burning questions? I think the right expertise is around the table.
I want to add something, Secretary said. As a healthcare provider, I've been here more than 20 years. Having seen children from newborn to adulthood, really our goals, our main goal for the children is to be productive citizens in the community. It's really the eventual goal, right? And so it's really important for the different sectors to partner to give these children opportunities to succeed. Yes, you take care of their physical health, but it's really so that they have good lives later on. And personally for me, a big success is when I see a 21-year-old, 22-year-old come back. After go, I'm an engineer now. I finished nursing. I'm waiting for my first doctor. But these are really, I feel like a godmother.
You should.
And they do come back because
That's great.
it's it's really for the community. Right? Look,
Well, and as you're saying this, I had my first speech language pathologist. She was in last week. She was so excited and graduated. But there's this feeling of when they show me pictures of that, they purchased a home. I had a patient come in, I'll never forget this. I have commercial insurance. I have a job that gives me
Yeah.
celebrate with patients on these things. And the fact that they want to tell us these things, it's just there's some depth.
Because you taught them the value of
Well,
it. Yeah.
And this is their home. I mean, that is the proof of what you're doing here. You have truly created a home.
The trust level.
Yeah.
I mentioned that earlier, and it made me think of, gosh, it was probably my first or second day at this site. I remember a patient looking at me when I walked in. Who are you? How long are you going to be here? You going to leave? I was like, not planning on it. And here I am, 8 years later, but kind of earning that trust.
Sure.
You know, not just expecting it to be given to me because, hey, I showed up for work today. No, I need to know you. I need to know your situation. If I don't listen to you and hear not just what you're saying, but read between the lines too, how can I expect why do I care if you need a colonoscopy? Why do I care if you need this if I don't care about you? And I think that's something, I'll just take a minute to brag up the team. Like, I feel like that is something my team does brilliantly. These patients feel loved, they feel cared for, and there's nothing that can replace that personal touch.
I don't think that
Dr. Arkoosh and I talk a lot about primary care and really the medical home, really where people feel connected. And you know, not just that patient, but you know their family and the community in which they live. And really, you know, you can't really provide good primary care unless you understand the environment and the family and the support or the lack of support or what they need. So I really appreciate what you do. And it really is, I think, again, how do we expand primary care access? Because that is the foundation. You know, people trust you to say, which gastroenterologist should do my colonoscopy, right? Who you're going to refer me to? And then getting those results back and being able to talk to the family. So, you know, that glue, that primary care provider in the medical home is the glue that helps people understand the medical care, which is very complicated. I mean, I try to navigate the healthcare system, and I'm a physician, and sometimes I'm bewildered at the challenges. And so I can't even imagine without that, you know. But again, I turn to my primary care provider for the same thing. Can you help me navigate this complicated system? And so, you know, the work you do every day is just so important. But you need the context in which these people live. Every person lives within a context of complexity, and you have to understand that complexity to provide quality care.
That's why I talked at the beginning about the people at Family First. Policies don't take care of people. It's you help people one person at a time, and it's just really inspiring the work that you all do.
I want to offer my gratitude for all of you coming out today and everybody joining us. The work we do, we've highlighted some of those wins, and they're there and they're important. And I also know there is a weight to our work that happens here in this health center and all of our sites. The situations that many of our families encounter every day in their lives, they're weighty, they're heavy, they're challenging and complex. And we hope that each of our sites provides a bit of a refuge from that and allows them for some moments to focus on their health. And you can see some great examples of some of our providers and their colleagues that extend beyond the people that are in this room that take that on every day. And that is a weighty role. And so you spending your time coming out today, offering your gratitudes and highlighting the work at this site is helpful. And I really want you to know that it's meaningful to our team to have that recognition, because it can feel, particularly in the time that we're traveling through, that weight is a lot to carry every day. And so this recognition is meaningful. Thank you.
You are not alone. We are here to stand with you. We can't wait to come back, so stay in touch. And if you have ideas for us, please let us know. You know, we've actually, Jenny and I sidebarred about one idea already. So if you have other ideas, send them our way. If we have questions, we will definitely circle back to
You
you.
know where to find us.
But, you know, we just really appreciate your time. Ma'am, thank you so much for joining us today. It was a pleasure to meet you and sharing your story. And just thanks for what you all do every day.
Thank you.